My name is Asma and I will be your nurse today. Can you please provide me your name and your date of birth?
John Smith, April 26, 1997.
Okay, so that matches our record. Can you please tell me why you are here?
Because of my stomach ache,
And where are you right now?
I'm in the hospital.
Okay, so you are alert and oriented times 4. Now I'm gonna be assessing your neurological assessment. Firstly, I will check your memory recall. I want you to remember 3 words. Please remember apple, banana, orange. Can you say it loud?
Apple, banana, orange.
Okay, now I'm going to test your math calculation ability. I want you to calculate what is 10 plus 15.
25.
Correct. Now I will test your abstract reasoning. Tell me what is raining cats and dog means.
It's raining heavily.
Okay, now I will test your judgment ability. So if you are driving and suddenly you see a red light, what you will do?
I stop.
Okay, correct. Now I want you to say the 3 words I told you to remember earlier.
Apple, banana, orange.
Correct. So by this assessment, we can conclude that your speech pattern is appropriate and consistent about the question I asked you. Now I will make some general observations about your appearance. Looking at you, your hygiene is properly maintained. And you do not seem to be having any kind of agitation or anxious. Your mood is calm and your attire is appropriate for your age, for your season and the cultural background, and you do not seem to have any kind of physical disability. So now I will start your skin assessment. So looking at your skin, I do not see any kind of rashes, no any kind of indication of soiling or trauma. Now I will use the dorsal side of my hand to check your skin temperature. So your skin feels nice and warm. Now I will check for your skin if it's moist or if it is dry. So I can see that your skin is dry, no excessive moisture or sweatness. Now I will check your skin turgidness. For that I need to pinch your skin. So no tinting, which means good hydration is maintained. Now I will check your capillary refill time in your nails. So it will be less than 3 seconds. So it is less than 3 seconds. That's a good thing, and your nails hygiene are maintained and no signs of clogging. So your skin and nail assessment is complete. Now I will start your head assessment. So looking at your head, I can say that your head size is normal, which we call normal cephalic, and I do not see any kind of soiling or any kind of infection in your hair. So now I'm going to palpate to see if there is any kind of laceration or any tenderness. I do not feel any tenderness here in this area. Now I will move to your facial assessment. So looking at your face, you seem to be calm, and also your facial structure, the symmetry is your face is symmetrical. No signs of any hemiplegia, which is one face drooping down. And now I will test your cranial lobe number 5, which is trigeminal. So it has 2 components. One is sensory and the motor component. So for the motor component, I want you to push your chin, close your mouth, push your chin. Okay, your motor component is intact. Now I will test your sensory component. So for that, I will give you 2 objects. I will put 2 objects in your face and you need to close your eyes and you tell me where do you feel it and how it feels. Okay?
Okay.
Okay, close your eyes. Where do you feel it?
On my right cheek.
Okay, and what it feels, smooth or sharp?
Smooth. Smooth.
Where do you feel it?
Left cheek.
All right, so your sensory component is also intact. Now I will check your cranial lobe number 7, which is facial nerve. So for that I want you to perform some facial expression. First I want you to smile. Okay, puff out your cheek and your eyes wide open. Okay, you can come back to normal. So I can see that you can perform those facial expression without any difficulty. So your cranial lobe number 7 is also intact. Now we will move towards your ear assessment. So looking at your ear, I do not see any kind of inflammation or redness, irritation in your ear area. And now I will palpate to see if there is any tenderness or laceration. So in pinnae, no any laceration here. And this is the tragus, no indication of soiling. And your master process, no. Okay. Okay, earlier I forgot to palpate your temporal arteries and your sinuses. So first I will do that. So I'm going to palpate. So your temporal arteries, I can feel the strong pulsation here. Your frontal sinuses, your maxillary sinuses, no tenderness here. And for your TMJ, I want you to open and close your mouth. Close. So I do not hear any sign of crackling or crepitus sound. So moving towards your ear, no indication of swelling. Now I will see your internal structure of the ear. For that I will use the ophthalmoscope, and I'm looking for your tympanic membrane. So I can see your tympanic membrane is pearly gray and it is intact, no indication of